On the Gary Bisbee Show, here are practical lessons from today's healthcare insiders. We'll uncover stories about their challenges, paths to success, and the skills that they've developed, as together we'll explore how the healthcare economy is transforming. Marcus Osborne is Senior Vice President of Walmart Health. Walmart and Amazon go back and forth as the largest retailer in the world. I believe that Walmart is ahead right now with 2020 revenues of roughly $525 billion and a current market cap of $375 billion. With nearly 4,800 stores in the U.S., if Walmart decided to provide healthcare in a big way, healthcare in the U.S. would change forever. We'll dig into Walmart Health's plans today with Marcus, and providers and health insurers will be listening, I'm sure. Walmart Health is testing its health centers primarily in Georgia, but also in the more urban area of Chicago. The price of an adult primary care appointment is $40. We'll explore what Walmart Health is learning and how satisfied customers are with the services and price, and what are Walmart Health's plans for expansion. As the largest retailer in the world, Walmart obviously gets high marks for convenience and affordability. How can Walmart apply its general merchandising knowledge to healthcare? We'll be exploring with Marcus in today's conversation. Marcus served as an intern in the Clinton White House. There may be a question there. Went on to work for the Clinton Foundation, decided to attend Harvard Business School, and graduated with honors. He proceeded to join Walmart and will now pick up his story approximately 14 years later. Marcus, we're pleased to have you at this microphone.
Well, thank you for having me.
Well, why don't we dig right into your background? We kind of teed that up. You joined Walmart 14 years ago, but let's go back to earlier days. What was life like growing up for you, Marcus?
I grew up first as the son of two educators. My mom was a high school teacher. My father was a teacher and then eventually principal and superintendent of schools. And then two, I grew up in central Kentucky, in Frankfort, Kentucky, which is the capital. Most people seem to want to place the capital as Louisville or Lexington, but in fact, it's Frankfort. So I'd say my sort of life was, was largely about school, and that when you've got two educators for parents, you pretty much live in schools all the time. And then I would also say it was a little, when you live in Frankfurt, it's all about politics. So I felt like I, kind of from an early age, also got involved on the political side of things early.
Well, in a small world category, I actually did my administrative residency between my 2 years at Walton at Appalachian Regional Hospitals. Oh. And spent time in Franklin and a number of other cities around Kentucky. So great, it's a great place for sure. So off to college, what were you interested in studying in college?
Well, I was actually interested in everything. I went to a small little liberal arts school called Transylvania. Most people seem to think it's in Romania, but it actually is. It is in Kentucky, and it translates loosely, I think, as over the mountains or west of the mountains, and it was the first school west of the Alleghenies in the United States. It's a liberal arts school, so I valued the kind of liberal arts. I wanted to learn a little bit about everything, but I ended up focusing in on, I majored in political science and minored in history, I had intended to go to law school. I think there were 11 political science majors the year I graduated. 10 of them went to law school, and I was the 11th who didn't. At the last minute, I just decided it was not what I wanted to do. So I found myself graduating with a political science degree and a history minor, and not quite sure what I was going to do with my life.
Well, you spent time in consulting, you spent time with the Clinton Foundation, and then off to Harvard Business School. What were your thoughts as you went through HBS about what you were going to do with your career?
People will say, well, why did you go to business school? And they think it's sort of obvious. If you have the opportunity to go to Harvard Business School, you go to Harvard Business School. But I actually needed to go to business school. I was probably one of the few people who was in HBS who absolutely benefited from going to business school. in that, as I mentioned, I graduated with a political science degree, and I went and worked in the White House, and then went into management consulting, um, uh, and I can tell you, and it was advising companies on business strategy, yet didn't have the fundamentals of business. I didn't understand finance or accounting. I didn't understand marketing, the core fundamentals of marketing, and so for me, business school was it was about um, learning the fundamentals. There's sort of a story when I was at the Clinton Foundation that as we had progressed and had been successful in lowering the cost of HIV meds around the world, we had a lot of countries who were supporting us financially, that they were willing to buy meds for other countries. So Irish and Japanese and the Swiss and others were willing to buy meds for Haitians and South Africans and the like. And it was in the billions of dollars when I realized there was a day that we were helping support these kind of transactions, this movement of money, where we were getting things, getting money from the Irish or the Swiss or the Japanese, and buying things from Indian manufacturers and shipping them to South Africa. And in the course of that, there were 4 different currencies in play, and we had to hedge against those currencies, and I didn't even know what hedge meant. I thought that was a good time to go to school, and so anyway, so that was for me. HBS was not, a lot of people enter with an intention of saying I'm trying to make some career change or those kind of things. I actually entered with the sole purpose of, I don't know what I'm doing in business. I don't understand the fundamentals, and so it's time for me to go back and get that base. So that's what it was for me.
Coming from a couple of educator parents, that would make sense that you'd actually go to graduate school to learn something, right?
Yeah, exactly.
Off to Walmart directly out of HBS, I believe. So you were, again, somewhat unique. I would think most of your class went to Wall Street or Silicon Valley. Probably few went into retailing. Why did you go to Walmart, Marcus?
Well, you couldn't have actually been more right. I graduated from HBS in '07, and that's an important date because roughly a year afterwards is when the meltdown, the global economic meltdown occurred. And you probably in hindsight could go back and see it. My section, over 90 people, and over 60 of them went into management consulting or financial services, hedge funds, and venture capital, and private equity, and those kind of things. And I looked at everybody going into it, and I said, I want to go do something very different. What is the opposite of hedge funds? What is the opposite of management consulting? And so I kind of look back, and I thought maybe my first job was at the White House, and I after I graduated from college, and I think about what I experienced there and understood the value of platforms and the ability of platforms to drive impact. So what really attracted me to Walmart is it wasn't a hedge fund. It was the exact opposite of a hedge fund. It had a real business, and they were really operating. They were running something that was very real and tangible in people's lives. Two, it struck me as just this unbelievably powerful platform that you could, if you go and are innovative and work hard, you can use that platform to really drive significant impact. So that for me was what drove me to Walmart.
How did you get into healthcare then?
It's kind of ironic. I would say, I was kind of in and out of healthcare, in management consulting. Probably, 20% of the work I did was health related. Certainly Clinton Foundation work was healthcare related. But the running joke is I had to go to a retailer to become, to get my degree in healthcare. So when I joined it, it was healthcare was, there's a business called the health and wellness business. It had only really been formally organized a couple of years before, meaning there had been Walmart had been in the pharmacy business and the vision center business, and had a huge business in direct-to-consumer healthcare when you think about OTC items and things like that. But those had all been in other parts of the business, or different parts of the business. it had only been about a year and a half before I started that they got brought together and a formal health and wellness business unit was created. Um, and so I actually was given the opportunity. I was asked, well, we think healthcare is going to be a big opportunity. We think financial services is going to be a big opportunity. Here's some other. We'd love to kind of put you into the areas that are going to be that are going to have impact. What's the most interesting to you? And I don't know. In that moment, I sort of chose health and wellness, and strangely enough, that's all I've done at Walmart. I could tell you almost nothing about retail operations or retail logistics or merchandising. It's been interesting experiencing healthcare through the lens of Walmart, both as a provider of services and products and also as the largest self-insured plan in the United States. And so it's a really interesting way to experience healthcare.
Well, it's kind of interesting because you're a little bit inside, a little bit outside. So you've got a terrific perspective. And I know that those of us on the inside of healthcare have appreciated through the years. If you were not a Walmart executive, Marcus, what would you be?
The joke to my friends is if I weren't a Walmart executive, I would be herding sheep in Ireland. Is the one I always love to say is my answer. Given my background, there's a reasonable shot I'd be a teacher. But I have to say, having particularly as I think about healthcare, if I weren't sort of at Walmart, I'd probably be wanting to help support those real disruptors and innovators that I see emerging that are going to bring about the real change and transformation in healthcare that it just I feel it is coming. It's probably not coming as quickly as we'd like, but so I'd probably be working, I don't know, trying to create my own, version of a digital health AI driven solution, because I'm a believer in particularly that type of technology and the way it's going to transform care for Americans and for the globe.
Well, it might be coming quicker than we think because of the coronavirus pandemic. It's certainly changed a lot. Do you have any thoughts about that, Marcus?
I think there's been a lot of conversation about this belief that COVID somehow it was transformative in the sense of that it changed the game. I actually don't think it changed anything. I think what the COVID pandemic and our response systemically, COVID was more of an accelerant, meaning there were already these things that were occurring, and what it did is it just put rocket fuel. And I think one of them is in this movement into I think what I call is an emerging omni-channel reality in health and healthcare. And what I mean by that is I think there's a little too much probably noise at the moment about telehealth. And I'm not, and by the way, don't read that as I'm sort of against or anti-telehealth. I just don't believe in telehealth in and of itself. I believe in telehealth solutions as part of an integrated omni-channel experience for consumers that combines more accessible care that's physical in nature, telehealth, digital health, AI-driven care, care in the home and home care, care in the community. And so I think, if anything, what it did is COVID, I think, created an accelerant to that movement into an omni-channel care environment, certainly for consumers. But I think the other thing that we're not talking a lot about here, which I think is a mistake, is it also accelerated the desire of providers and professionals to want to participate in that omni-channel environment. I think there were a lot of physicians, for example, who were skeptical of working in a telehealth environment or working in a digital environment, and then got exposed, and now all of a sudden they themselves are more convinced. You're seeing a lot of these providers and professionals raise their hand and say, I want to now be part of this new omni-channel experience that we can create for patients, for consumers. And so I think that's probably what it did, is it's just accelerated our belief of what is possible, and taking something that might have been 5 or 7 years out and saying, no, now it might be 2 or 3 years out. It's kind of moved the top of the mountain a lot closer to us.
Yeah, I think that's right. Well, most crises accelerate existing trends, right?
That's right.
And this one certainly has done that. Why don't we turn to Walmart Health? And I'd love to get your thinking about the omni-channel in terms of Walmart Health. But first, could you describe Walmart Health for us, please, Marcus?
Sure, I think it is, at two levels. The vision is an it was about creating this omni-channel experience, and it was really about fundamentally, at its core, Walmart Health is about enabling people to get the care they need right now, the basic care they need right now, and to be able to afford it, to have it be accessible for them, to have it be simple to act, to engage with, and because what we were seeing, or what we see today, is a system that, because of these challenges of affordability, because of these challenges that people talk about the lack of convenience and accessibility, because of these challenges of people complaining about the complexity, that we as Americans are deferring, delaying, or never getting the care we need. And and so Walmart Health is about creating an experience that begins to address that. So the first manifestation are opening of physical sites. The physical sites, they are about bringing together an integrated set of services that are designed around the needs of consumers. So primary care, behavioral health, social health, ancillary services like dental and vision and hearing, access to community services like fitness or nutrition or life with baby programs. We're testing physical therapy in some sites, where the goal is to bring those services that people need together, make them affordable. Yet we do accept insurance, but even if you don't have insurance, or maybe you're on a high deductible plan, you should still be able to afford care by making these things cost effective and making them really convenient. That's been the model, and so we've kind of started there with physical sites, but I think we're on this journey to say, what does that broader omnichannel experience look like?
We were doing a little research and found a quote from Sam Walton back in 1991. Said, we've got to get the hospitals and doctors in line. We've got to get those charges under control. And the unfortunate thing is, I don't know if any of that has changed, but maybe it will going forward, Marcus.
It's interesting you mentioned that. I mean, I think that's a great quote about, here's a guy who I think at the time, was, if not the wealthiest person in the world, certainly one of the wealthiest. And he's complaining about his own sort of experience about how unaffordable care is, and how it was impacting even his own desire to get care. And and it sounds strange, but I think this is one where often this kind of, these challenges that we see, they are universal. I think there isn't an American who, if you ask, it won't tell you that they didn't get some care they needed because of some of these challenges. So I think it is interesting.
So to the services, Walmart Health, is there any kind of urgent care type services, or is it more just general primary care?
As we look at the people coming in and what their needs are on the medical side of the house, there's a reasonable percentage of people who come in that are coming in for urgent care needs. They're coming in for the scrapes, breaks, and sprains kind of things. They're coming in with, pink eye or sinus infections or strep or flu or but so there is an urgent care component. I mean, I consider those kind of part of the urgent care environment, and given that we have access to imaging, X-ray, and EKG and other things, it enables us to kind of support in that. But the bulk of the visits we see are actually more for people who have chronic illness, who are looking for support around their chronic illness, people who are looking for preventative or wellness needs. So I think it's a mix. It's a mix, and I'd really say it's truly kind of primary care in its fullest. It's the the model that we're kind of seeing play out is sort of the primary care that people would talk about of the local family doc who took care of everything. I mean, that's really what we want to be, is we want to be able to have people come in and get their needs addressed from an individual dealing with chronic illness to be supported longitudinally to somebody who just might have an episodic need.
Well, you're talking about chronic disease. I wanted to ask you about that because with the roughly half of the 70 million baby boomers are now on Medicare. So over the next 20 years, 25 years, there's another 35 million coming online. There's going to be increasing demand for chronic care. Do you think that's a feature of Walmart Health, or is it something that you'll do if somebody presents themselves for it?
No, it definitely is a feature, and we're already kind of stepping into it. I'd say we launched, for example, our first formal disease-specific program focused on diabetics. We did that actually in tandem with our Chicago launch. So no, that I think will certainly be a big part of it. I mean, I think, again, at the end of the day, we're trying to address those core needs. And the example I mentioned earlier that we've introduced in a couple sites, physical therapy. The reason for that is it was just an extraordinary fact that when people who were coming in for primary care, everybody's filled out these questionnaires of you've come in for whatever. Maybe you come in to get your checkup, or maybe you've come in because you've got a sinus infection, you're not feeling well. But then you're always asked, are there other things that are sort of from a health perspective that you're concerned about or bothering you? Musculoskeletal issues were huge. I mean, people were, knee pain, back pain, hip pain, shoulder pain, elbow pain, whatever. And so that was, so our point on that is that was why we've started to test and see how physical therapy services work. The reason I say that is the same applies on chronic disease. We are seeing people coming in, and the rates are in line with rates of diabetes, the rates of cardiovascular illness or heart disease or your other issues. So we absolutely, I mean, that's going to be a big focus of Walmart Health. And our challenge is how can you best address those needs as effectively, at the highest quality, and as efficiently as possible. So that's what we're challenged with.
Why don't we turn to staffing?
Yep.
Are you developing your own staff, your own training programs? I know there's a college that Walmart is running, but how are you dealing with the issue of staff, nurses, doctors, and others?
Certainly for the key provider roles of the MDs and the nurse practitioners and the dentists and the optometrists, those we're having to go and use a normal recruiting process and kind of attract. And we're going to try to find kind of novel ways to target those providers, to find the ones who are really most interested in the work we're doing. But we are starting a process that you mentioned, Live Better You, which is a degree program that we actually created for our associates. A fun little fact: we went and actually did a survey that out of the roughly 1.5 million associates in the United States, somewhere between, I want to say, just under maybe 60 to 80,000 of them already had existing degrees in healthcare. So that they were, might be somebody who was already a medical assistant, or they had already been certified and had been working as a community health worker, or had been a personal care assistant for an at-home care group. Some of them more advanced. I mean, we were kind of surprised. We were finding nurse practitioners and nurses and hygienists and other people who were also, working with Walmart overall. But to your point, we are starting now to use Live Better You as a way to say, well, can we identify associates who are inclined and really interested in the work we're doing and support their education, support their process to become trained in some of these roles, a CMA or as a tech in the optometry business, or as a nutritionist or whatever it might be. So we will there's more to come there, but certainly we have started a process to look at how we can basically develop our own pipeline of talent and professionals to support the bulk of our staffing needs.
Is there any thought about developing relationships with local providers, the health systems or doctor groups to provide some care for the centers?
Yeah, certainly that's a great question. We have started those conversations. I think there are opportunities potentially to, as you mentioned, leverage the existing health systems that, it could be even to the point of in tandem kind of employing, primary care physicians or other providers and having them kind of work within Walmart Health and the health systems. That is certainly going to be a focus of ours going forward. We have started down that path, but I think there's more to come.
Marcus, how about health plans? Any idea of working with specific health plans, maybe for populations like Medicare Advantage or Managed Medicaid, something like that?
Yeah, I'd say we're already actually going down that path and have gone down that path. I think about there being probably two buckets that we're engaging with. One is the health plans themselves that are particularly in Medicare and Medicaid. The need there, and this is a journey that we're on, is this kind of desire to move Walmart Health into a more value-based environment, value-based care environment, to think about how we can, and we talked about it earlier, how we can operate and deliver care that's longitudinal in nature, that is oriented to fee for value over fee for service. And so I think certainly that is a journey we're on. I'd also say, and we've started this kind of process of thinking about how what we're doing could be packaged up and can become consumable for commercial groups, for employers of all sizes, and we've actually started some things, done some things there, and to think about how what we're doing could help better address the health coverage needs or health care needs of their employees and their spouses and dependents. And so certainly there's going to be a lot more coming around work we're doing with health plans to really kind of leverage, create deeper partnerships there.
How many of the consumers using the health centers are Walmart employees?
When we look at the kind of total actual unit numbers, it's an extraordinary number of associates and their families are using it. On the other hand, because we've been fortunate to have really good volume. In fact, I think we just kind of passed a big threshold for us, and now we can talk about having served hundreds of thousands of patients. But when you look at it, associates today, will kind of make up 2, 3, 4% of the total volume. So they aren't a huge portion, percentage portion, but they are. But when you look at overall numbers, we're seeing a lot of them. And as you know, the best marketing is word of mouth, and so our associates. The more they use us, the more they're telling their friends and family and the people they go to church with in the community and and so we're finding that our associates are proving to be our best marketing vehicle.
Have you developed your own information system, or will you be using, ones you purchase, or how are you handling data from these encounters?
That's a good question. So the way we kind of think about it is this: that certainly we are bringing in standard kind of electronic health records and clinical tools to help run the overall operation, but we are also moving to as we think specifically about data, a kind of larger integrated data environment, because you think about all the ways in which it's not just about the information, health information created about you in Walmart Health. It could be what's occurring in pharmacy. It could be that you have done a health screening on the Pursuant Health or Higgy kiosk. Those are all, it could be that you showed up to a Walmart Wellness Day and got blood pressure done, or you got your glucose or A1C or cholesterol checked, or you had a BMI done. We think about it could be about what are your behaviors in the store overall around your kind of nutritional habits or your sleep, your habits as it ties to your, purchases that connect to sleep or exercise. And our point is all that is kind of pertinent health information that when kind of brought together in the right way and organized in the right way, and in which insights get generated in the right way, you can really have a much deeper impact on somebody's health. And so, data is a big piece. So some of it, our kind of view on that is that those are not, that sort of goes beyond the standard EHR approach. And so some of this we're actually having to kind of invest in and create ourselves.
Well, you're really moving from strictly healthcare to broader social determinants of care, which is terrific. Where do you see, as you expand the centers, where do you see competition from existing providers or from the Walgreens and CVS's of the world?
Well, I mean, this will probably be a strange answer. I hope all of them. I mean, I hope everybody's trying to kind of up their game. I hope everybody understands that that the opportunity is to better serve consumers, and you do that. There's volume to be had there, and not only can you do good, you can do well. And so I think to your question, I think certainly some of the health systems are trying or will kind of to think about different approaches there. I think certainly even some of the health plans. I mean, you look at what United is doing with Optum, or what Humana and others are doing. I certainly believe CVS and Walgreens and Amazon and Kroger are all going to play a role, and then I fundamentally believe the technology guys are. I think Google and I think Microsoft and others are going to have a role to play, and so yeah, I think it's going to be. I hope it gets crowded and more competitive with more compelling solutions. Compared to what I've seen on the financial services side, less kind of transformative action and thinking. And so I hope that at some point this sector, with both traditional and non-traditional players coming in, that we get as aggressive as we've seen the financial services industry getting around trying to create new consumer solutions.
Well, somebody has to lead, Marcus, and Walmart certainly has the size, and you all are being very creative as you go about doing it. So we look for good things coming out of Walmart in terms of your leadership role. This has been a great interview. I'd like to ask one final question, a little bit of an odd question probably, but what can the existing providers learn from Walmart Health and what you're doing now?
The biggest thing that I think anybody can learn is that there is this kind of equation of sorts that if you want to say, if your goal and your purpose is to help improve the health of Americans, that first and foremost, you do that not by sort of dumping lots of knowledge on people, but you do that by first and foremost actually helping people feel more engaged around their health. When they are more engaged, they feel more in control. When they feel in control, they feel empowered. When they feel empowered, they act. When they act, then things happen. And so what does that actually mean? I hear a lot of conversation where now you talk about health systems or service providers or whatever will at least sort of try to kind of speak to things like net promoter scores and the like, and they'll say, oh, I've got a net promoter score in the 40s, or but I would say is just because you have what you consider to be even if you have a reasonably good net promoter score, maybe you got one in the 60s or 70s or 80s. I think setting the bar and saying you're in the consumer experience business, and that you need thinking about service and what it actually means to serve and deliver really great consumer experience. You think about, how can I match it? And it drives my team nuts because I always use them as an example. But how can I deliver a service in healthcare that is akin to what Chick-fil-A delivers in fast food, right? How can I deliver in healthcare a service that is akin to what Four Seasons delivers in the hospitality industry, right? How can I deliver in healthcare what Apple, frankly, is delivering at retail? Because I think they have one of the highest net promoter scores in their store, in the Apple stores. So my recommendation is to use them as a standard and to understand that you're in the consumer experience business. And if you create a phenomenal consumer experience that is built around health, and still focused on delivering quality care, but if you focus on that experience and couple that great experience with phenomenal quality of care, you will actually see significant health impact and health change on the population.
Marcus, this has been a terrific interview. I think this is a good place to land. We really appreciate your time today, and hope things on spring break with you and the family work out well.
Well, thank you so much.